Hello, I want to welcome you to a discussion of the wellness initiatives from H.R. 3962, the Health Care Bill. I am Reverend Dr. Al Locke, and this is my wife, Reverend Dr. Ruth Locke. We believe it is imperative to start a discussion on the wellness and prevention component of the health care bill that is signed into law. This bill is designed to change the health care delivery system, create jobs, and create educational opportunities for coverage for the health care of Americans. If you ask most people, they have no idea what's in this health care bill. Most coverage of this bill heard on television is laced with fear, confusion, and distortions. Let's at least examine what's in it before the voices of opposition and repeal drown out any logical examination of its contents. It is not perfect, but I believe it is a good blueprint to build upon. We are both registered nurses and chiropractic physicians who practice in the Chicago area. Dr. Ruth and I have over 50 years of combined healthcare experience as nurses and 20 years as chiropractic physicians. We own and operate a chiropractic and wellness center, a home health business, and are ordained ministers of the apostolic faith. We're also national directors of prevention and wellness of the Apostolic Company. We fundamentally believe that holistic healing consists of mental, physical, spiritual, and environmental aspects of the human experience. Therefore, we believe our experience and our credentials give us a unique insight to start this discussion with you. Now let's begin by summarizing and discussing some practical applications of the National Prevention and Wellness Bill. Our information and summaries are extracted from this bill. First, the term wellness services means any health-related service or intervention, not including primary care, which is designed to reduce identifiable health risk and increase healthy behaviors. This is intended to prevent the onset of disease or lessen the impact of existing chronic conditions by teaching more effective management techniques that focus on individual self-care and patient decision-making.
So Al, what you're saying is the wellness and prevention portion of the health bill is designed to promote and encourage individual empowerment in the management and decision-making of their health care needs?
Yes, Ruth, by providing resources and grants and changes in the health care delivery system through policy and governmental mandates that will promote generational wellness and empower the individual and communities in the health care process.
Okay, Al, so I understand the wellness and prevention portion, but the more effective means of management is something that we already do. We teach diet and nutrition. We teach the importance of exercise. We also teach about medication and the importance of following the regimes. We teach on the disease processes, so what's different? What new vehicle or approach is this bill speaking of?
The current system is not effective, Ruth, and at times disjointed. By establishing national priorities and objectives for prevention and wellness, identifying health disparities, providing payment incentives, and developing a prevention workforce through the community-based collaborative care networks, we feel will provide a more holistic approach to individual health care. Now let's talk about some of these new policies. In Section 3151 is the Community Prevention and Wellness Service Grants. This program established the delivery of community prevention and wellness services by awarding grants to eligible entities. This is done by establishing health empowerment zones, which means an area which multiple wellness services are provided to address one or more health disparities. Ruth, I am excited about the creation of nurse-managed health centers and grants to promote positive, healthy behaviors.
Well, Al, could you explain the grants to promote healthy behavior?
Ruth, there are grants for populations in underserved communities that through the use of community health workers will educate, guide, and provide learning opportunities in high-risk behaviors that include poor nutrition, physical inactivity, being obese or overweight, tobacco, alcohol, and substance abuse, injury, violence, and risky sexual behavior, untreated mental health problems, untreated dental and oral health problems. Ruth, the community health workers will educate and provide guidance to promote positive health behaviors within the entire family. They will also educate and refer to appropriate health care agencies, community-based programs, and organizations that increase access to quality health care and preventive services. They will also provide and educate home visitation services regarding maternal and prenatal health care. So it really kind of includes the whole family in this process.
Well, Al, it sounds comprehensive, but what are community health workers, and can you identify what the government considers as a health professional?
Well, community health workers are part of a public health workforce corps established in Section 340L of the bill that consists of scholarships and tuition forgiveness programs to plan, develop, operate, or participate in an accredited professional training program that includes nursing, preventive medicine, laboratory science, dental medicine, and teachers. The bill also describes health professionals as those in family, internal, and geriatric medicines, pediatrics, obstetrics and gynecology, podiatry, chiropractors, nursing, psychiatry, psychology, social workers, marriage and family therapists, and other healthcare professions.
Well, I notice another unique component of this bill. It is the creation of the Medical Home Pilot Program in Section 1722. This program is designed to provide patient-centered medical home services. It is set up around a primary care physician, nurse practitioner, or physician's assistant to coordinate continuous comprehensive care from a team of healthcare professionals to the patient in the home setting. The coordinator will provide and arrange care through all stages of life, provide continuous access to care and communication with other participants, provide support for patients' self-management, patient monitoring, family caregiver, and coordinate with community resources. Also under this program is the creation of community-based medical home program, which is defined as a not-for-profit, community-based or state-based organization that is certified to provide patients with medical home services. The purpose of this approach is to improve the quality and coordination of health care, reduce health disparities, reduce preventable hospitalizations and readmissions, reduce visits to the emergency room, and improve the overall health and function of the individual. Now, because of the time restraints, we want to briefly mention a few other programs in this bill. Office of Women's Health, the Office of Minority Health, improvement in adult daycare health centers, extension of Medicare senior housing plan, teen pregnancy prevention programs, medical legal partnerships, telehealth expansion and enhancement, online health and workforce training programs. It assists veterans to become EMTs. It has an expanded program to provide continuous education to the nurse and health science training programs in the secondary schools. These are some of the programs and initiatives in the health care bill.
But Dr. Ruth, let's face it, there are no easy solutions to the healthcare crisis we face. On one hand, we have cries of deregulation and for freedom of capitalism that we see can lead to insurance monopolies and unchecked premium increases. Even now, they are raising the premiums to 60%. Soon, only the rich and the well-to-do will afford health insurance. Unfortunately, most jobs are cutting health care coverage and increasing the rates for what little coverage they offer. And newly created jobs are offering no coverage at all. It's also stated that the #1 reason for bankruptcy in America is caused by a health crisis. Now, on the other hand, emergency rooms are being flooded with people who have no other means for treatment, leading to 12, 18-hour waits. With overburdened and overworked staff, that can cause mistakes and at times give minimal treatments to major problems which can lead to needless injury and death of Americans. Neither extreme is acceptable and sustainable for America. As a nation, we must rise above the polarizing politics of us or them and realize the strength of the health of all Americans is a vitalizing force of America. For your health is your wealth. It is our intent to continue this conversation across the spectrum of religious and community leaders, medical organizations, and with you through the use of the media and workshops. If you agree with this discussion of the healthcare bill, please donate to the Temple Building Ministry so we can continue and expand this format. Thank you and God bless you.
I hope you are just as excited about it as I am. We want to thank you for joining us, and we hope you continue to follow us on the discussion of the healthcare reform bill. Thank you again.